The shift to value-based healthcare means that the industry is changing, but not always in ways that we can see. That's why risk stratification is so critical for offices that are moving towards value-based care, both in the ways that we describe the patient's condition, but also in the ways that we participate in the healthcare system itself. Here to speak with me about her practice's experience with the hierarchical condition categories in HCC, which is a method for risk stratification, is Dr. Martha Rodriguez, CEO and President of MMR Healthcare here in Boynton Beach, Florida. Dr. Rodriguez, thank you so much for your time today. So one question that we get asked often is, if I'm a provider who's still billing for 99213, the office visit code, why do I care about risk stratification in HCC? I mean, in other words, if these providers are not part of a managed care contract, they're not in an ACO, or part of alternative payment programs, they might think that there's no reason to participate in HCC. What are your thoughts on that?
Well, I have very strong thoughts about that because I believe if you don't participate in Hcc modules and Hcc programs, you're going to be out of practice. I mean, healthcare, we know what doesn't work. We know that the way we were doing it didn't work. The only way to transform the future is to use risk to evaluate the cost of patients' care and be able to direct budgets appropriately.
How is HCC, since HCC and risk stratification is such a critical part of this shift, how is this changing the way that primary care is being perceived in healthcare overall?
Well, primary care is taking a lead, which is different in healthcare. We used to be the last on the list. It's us that we are able to identify the patient's risk and direct care after that is going to really change healthcare. Using this model is the only way that we can identify the patients and how to evaluate their risk and categorize them.
Now, risk stratification with the HCC model is dependent mostly on the conditions that the patient has. Why is accurate coding so important for HCC? And how does primary and secondary manifestation codes play into that?
Well, Hcc is really, in my opinion, a language. You know, it's not what you say, but how you say it. So educating and learning this language is important, but documenting is also important. And to track your documentation so you do it appropriately as many times of the year as is necessary is a big task and it's a challenge. So the use of a tool really helps and facilitates that.
Why is accurate coding with HCC so critical, and what role do primary and secondary codes play into this model?
Well, Hcc is critical because it's the Hcc that really dictates the category of risk of a patient. Without us properly identifying the primary and secondary diagnoses on a patient, documenting them properly and reporting them properly, then the government doesn't know what amount of budget to allocate to each patient. It is Hcc that guides the government and us to do that.
And of course, then if they're not allocating enough resources for that patient in the value-based care model, then that's going to affect the providers who are caring for those patients as well. What are the biggest challenges to participating in HCC and succeeding in HCC?
The biggest challenge is a program that needs education. You know, it takes a shift in mind. We were used to just writing a diagnosis and going on to the next. It does require more documentation. It does require paying more attention that you report that documentation, the amount of times that needs to be reported. So it does require a challenge of shift of mindset.
A lot of practices are saying that they get reports from their payers, their ACO, whatever plans they're participating in, that include lists of these conditions that need to be recaptured for HCC. Is this enough, or are practices really shortchanging themselves if they don't have some other way of dealing with this?
Oh my God, that's not even close. The fact is that in the past, the way we worked with those lists, that we would get a list of diagnoses that we had to report, is that we had to have staff manually go back and audit charts and report and rebuild and redo. A lot of times losing the chance because you can't alter a note after 30 days. So a lot of times you lose the chance to report things appropriately. Depending on the insurance company data, which is always 90 to 120 days late, makes you lose an incredible amount of financial benefit from the Hcc module.
So in other words, I think what you're saying is you're playing catch up a lot and you're having to dedicate a lot more staff time because of that. Now, of course, you are using the eClinicalWorks Hcc module, which is built into the progress note, and it comes with a dashboard. What does the information that you get look like there, and how does that help you to be more proactive instead of reactive?
Oh, it changed dramatically. It's now at the point of service when we see the patient that we can see how we report things and how the score increases dramatically based on your information and your documentation. So you're tangibly able to follow that and see what you're missing at the point of care.
What steps did you take to make sure that you and your staff are accurately coding to improve that patient care?
A lot of education. We've had consultants come in and continuously come in and educate our staff and ourselves. We also have insurance companies have people available that educate you constantly. So we have monthly seminars with them. Education is critical for Hcc success.
And does the tool play a role in that education?
The tool plays a big role in that education because by the use of a tool, we can demonstrate to the clinicians, if you didn't put this diagnosis, look at the score versus putting this diagnosis right in front of them. It's critical. It's incredible.
How does the eClinicalWorks Hcc module increase accountability while also improving the provider's experience at the point of care?
Well, that's a very interesting question because in a practice like mine, for instance, where we have several clinicians, it's very difficult to know what the other clinicians are doing. In the past, we really didn't know. For instance, if a clinician is doing a physical, if they approached all the critical Hcc conditions. With the module, we're able to see what was done on each visit, and we're able to track and see what the score of the patient is as the year is progressing, something that is dramatically different from what we used to do in the past.
So far, we've discussed the use of the Hcc module with a single patient, but as we said, it also comes with a dashboard. How are you using that dashboard to gain better insights into what's going on in your patient population?
Well, the dashboard is very helpful because the dashboard offers something that we never had. One issue that we have very difficult is, for instance, when you identify a patient and this diagnosis is reported, then you have to go to the front desk or look on the computer when the appointment is. In the dashboard, you're able to see the trend of the Hcc, what's happening with the Hcc. You're able to export the data, but more importantly, you're able to see even when the patient's next appointment is, so that you don't miss the patient's collection of data that is critical for the year's data.
Now, your group, MMR Healthcare, is part of an ACO here in Florida. How has the Hcc module helped your practice with that participation?
The Hcc module has increased our Hcc score dramatically because we're able to follow it through the year. I mean, like dramatically. We can see every month the increase in Hcc score that we couldn't ever do before. We depended on data that was sometimes a year old from the ACO. We can see now on a monthly basis the dramatic improvement in Hcc score. I mean, it's really dramatic. We get reports from the insurance company about the Hcc score, what the projected is and what the past Hcc score was. And a lot of times, because the practice grew so much and we have different clinicians and we cannot always know what they're doing, we never really knew what was happening to the Hcc. We held the highest Hcc score in Florida for many years. And when the practice grew, I lost control of that because I didn't know what the other clinicians were doing. And because I depended on all data, it was very difficult to change that. Since we have the module, it has been a persistent, consistent increase in Hcc score every month because we're able to change it at the point of care.
A lot of emphasis is being placed on the need for collaboration between primary care and other settings of care for the patient, integrating behavioral health, integrating pharmacists, and so on. You collaborated with radiologists. Where did that idea come from, and what did you do about it, and why does that relate to your Hcc scores?
So when the Hcc model came out, I realized that, like I said earlier, it's a language. And unless we all spoke the same language, we weren't going to get anywhere. So what I did is I went to the radiology group that we used in the area, which was a very big group that was out of the hospital, in the closest hospital here. And I educated all the radiologists on Hcc. I educated them I gave them templates on how to read x-rays. In the past, for instance, a simple chest x-ray would say no acute disease. Well, that doesn't serve us any purpose because to document atherosclerosis of the aorta, we need a backup radiology test that tells us that. So I educated them on the importance of mentioning the size of the aorta in a chest x-ray, something that was never done before, or the way the vertebrae looked on an x-ray. All of those things that were never done. By educating the radiologists, we were able to increase the HCC score dramatically.
All because you had that backup of the information that supported what you were really
Correct.
looking for. So I guess don't be afraid to work and reach out beyond the walls of your practice and work with those other providers. Dr. Rodriguez, thank you so much for being here, and thank you so much for your thoughts on HCC and why that is critical for your practice. If you'd like to learn more about the HCC module available from eClinicalWorks, you can check out my.eclinicalworks.com or speak with your strategic account manager. And don't forget to check out our other episodes on iTunes, YouTube, and my.eclinicalworks.com. For the eClinicalWorks podcast, I'm Adam Solati, and thanks for watching.